Hello, and welcome to our weekly edition of the Haverhill Educational Update. I'm Superintendent Margaret Murata, and as we edge closer to school, we have many exciting changes and policies and updates to share with you. Today's edition, I'd really like to focus on questions related to medical situations in our schools, both COVID related and non COVID related, and the many questions that families have about how this will be handled in the schools and how they'll be notified of any situations that occur. And to have this conversation, I've invited our nurse director, Katie Voziolis, to join us today. And she'll be coming right along in a minute to share some information with you all. I have a list of frequently asked questions that we're hearing from many families across the community, and we hope to quell some anxiety and just help people feel more comfortable with the return to school. And I'm now joined by Katie Voziolis, our Director of Nursing Services. Good morning, Katie. Thank you for joining us.
Good morning, Dr. Murata.
I appreciate your taking some time out of your extremely busy day at this point to help share some information with parents. There's lots of questions in the community, and we want to try to answer some of those and just give parents a little bit of peace of mind and what to expect as we start to file back to school.
Of course, I'm happy to be here and anxious to share much of this information with our families.
Great. So we've been collecting some questions from families, some sort of frequently asked questions, and we'll just go through those questions and answer them to the best of your ability. I know things are constantly changing and you may not have all the answers, but just let us know what you do know.
Perfect, thank you.
Okay. So the first question is, what will happen if my child feels unwell in school or if my child exhibits signs and symptoms that the nurse believes might meet the criteria for COVID assessment? And what happens then? And if I need to come pick up my child, where will they wait until I get them?
Of course, and I think this is some of the biggest concern for our parents. Um, Haverhill Public Schools and our school health services is trying to align all of our protocols with the guidance that we've received from the Department of Education and Department of Public Health. And they've published for us very what we call prescriptive protocols to follow as we manage COVID-19 type symptoms and situations of positive COVID cases. So to answer that question, if a child exhibits symptoms or seems unwell when they say arrive at school and the teacher feels that they are unwell, maybe they're coughing or maybe they're sneezing or they have a headache or a stomach ache, whatever that situation is, the teacher will be asked to contact the nurse, and the nurse or a designee will most likely come get the child, or will have a system to get that child to the nurse to be assessed. Again, they've given us some very specific guidelines to use in evaluating students. And based on those symptoms, the nurse will determine if this child fits the criteria. That they would, in fact, then be somebody who we would ask the parent to take home, and we would be asking them to get that child tested for COVID-19. So that is how that would work. In each school, again, we've been asked to create not only our typical health services, or what we're going to call now our well services area, where the nurses would see kids with their chronic conditions, maybe it's diabetes or kids receiving medications, but we're also creating spaces, medical waiting spaces, where we can safely maintain students who are waiting for parents to pick them up. So they'll be separate from those kids that are coming in for day-to-day services or maybe in for an injury. So we're going to be, again, kind of separate spaces with very specific guidelines in those medical waiting spaces. And there'll be supportive services there as well. Those rooms will be monitored by an adult at all times. Children will be wearing masks. They'll be at least 6 feet apart. Obviously, meals will be provided. They'll be taken out for breaks. They'll have access to the restroom. For many students, because the symptoms are so mild that we're being asked to sort of use in part of our assessment, many of these kids will actually feel fairly well and may even feel well enough to sit and do some homework. So there will be some desks and chairs, and there'll be some different situations for kids.
Right. So I know that we would hope that parents would come as soon as they could to get their students. And I think you're just talking about the situation where maybe the parent works in Boston or is further away, and it takes a little bit more time to come get the child. That we would be, able to support them in that environment until the parent was able to get there.
Yes, of course. And we're creating large enough spaces and enough spaces so that if we do have that delay, of course, we're going to be anxious for parents to, they're going to be anxious when they receive that phone call, and we'll want to help move this process along with them.
Absolutely. Thank you. So it seems like well, it's true, some of the conditions or some of the symptoms of COVID are pretty common symptoms that, people experience with a wide variety of illnesses, and some of them just things that people live with, asthma, allergies, things. I think parents are asking every time a child coughs or sneezes, would they be sent home? And would that be different if they had a known condition?
So again, really important question and important information. We do know our children well, and for those kids with known conditions, we'll be working really closely with families, and we'll be encouraging families. For example, if you have a child that has seasonal allergies, please now contact your primary care physician, get their medication regime up and running, put them back on, their preventative medications if that's what they're on. Really, if we're going to ask parents to be pretty aggressive about managing their children. And then, of course, communicating that with the nurse, providing some documentation from from that physician, so that we have sort of a baseline and we have information to work with. If we have a student, say, who has asthma, a cough alone is not a reason that we would send a child out. We would manage their asthma to the medication plan that we had in place. But if that child had a cough and had a fever and had a stomach ache, then in that case, that child would go out because of the multiple symptoms. So there's a little bit of a balancing act for the nurses. Again, our guidance is being tweaked every day. I think that if one of the new sort of pieces of guidance that we've been getting is that if a child comes to the nurse and their symptoms actually improve rapidly, it's unlikely that's COVID, and based on the nursing assessment, that child could go back to the classroom. We know that children present with a lot of symptoms that are caused by many different things, and some of that's anxiety, and all of this is anxiety producing. Maybe it's food security. There can be a lot of things. So when kids say they have a stomach ache or a headache, we're going to be very cognizant of the fact that there may be other factors playing in, and the nurses have a big job in trying to make the best determination. We want to follow the guideline as closely as we can, and we want to be as conservative as we can, because we want to try to keep as many people healthy in our buildings and really try to mitigate the potential for cases and spread of COVID. We're not going to get it right 100% of the time, and we're going to ask parents' patience with us as we work through this, because we understand what a hardship it is when we call and say, we need you to pick up your child and we want them to be tested. And I'll mention that one of the things that we have in the works in terms of testing is that we're developing some really nice, close relationships and agreements with some local providers for some potential additional testing options for families to help facilitate testing, and some guides and some tools. So, our role will be to really try to work closely with that family in what those next steps are for their child.
That's great, Katie. Thank you. And I think I heard many very important things in there, but a couple things I wanted to highlight, because I know there are some of the other questions that parents are asking, and you sort of answered them in there. One of them was about if your child has a scheduled medication or treatment, would they be exposed to children being assessed for COVID? And I think you said that we would have sort of a wellness area and more medical waiting area, so we would separate those two groups of students.
That is correct. And I'll just mention, while we're on that medication topic, that that, as we start to reopen with staff over the next week or so, the building nurses will be working with principals to schedule times for medication drop off prior to the start of school. And, they will certainly reach out directly to those families that they know need to drop off medications, and make sure that the parents have the right paperwork in their hands that we need completed. And the nurses will most likely be, at a table outside meeting parents on scheduled appointments, say, on a Thursday or Friday before we open, so that we've really got everything in place for a child prior to the start of school. So parents should be on the lookout for that. The principals will also put some information into some of their memos that are going out to families as well. But the nurses will be in the building and starting to reach out to those families that we already know or we anticipate will be bringing medications. So that is our current plan for that.
Excellent. Thank you. Thank you. And another big concern of a lot of families is how will people know if their child has been exposed to another student or a staff member that's tested positive for COVID? That's a contact tracing question.
Of course. So let me first say that, we are going to be assessing many individuals for symptoms. They're going to come through our office, and a portion of those will be sent home, and we'll be asking those parents to have those children tested. And of those ones that we send out to be tested, only a small percent, if any, and at some point there will be one, will actually test positive. So, we don't anticipate that every child we send out is going to test positive. We're just following the guidance from DPH to try to really, again, prevent having an outbreak of COVID in our schools. So once we send somebody out, and that anybody who's been tested for COVID-19 must isolate, quarantine until that result is received. So if that result is negative, then that parent would be able to return that child to us to school after they're symptom-free without aid of medication for 24 hours. If they are positive, we are hoping that our relationship with the family would be that the family would let us know directly, but we will also be working in concert with Mary Connolly, the public health nurse, and would be notified by public health as well that we had a student who was positive. The district is putting together many different plans so that we know where a child sat in the classroom, where a child sat on a school bus, who was in school what days, those kinds of things, who was in a pullout, all sorts of different situations to the best of our ability, so that we can provide to Mrs. Connolly, to our public health nurse, a list of those students or staff who fit the criteria for having been in close contact, and that currently is defined as within 6 feet for a consecutive 15 minutes, not cumulative, a consecutive 15 minutes with or without mask. So, it isn't, not everybody a child's been exposed to would be somebody who would be considered needing to be contact traced, but we'll be working to try to assess, what that group of people are, and then working with Mary Connolly. We are currently developing plans with Ms. Connolly about that communication back to parents and what that would be. The actual contact tracing part from a state level does come through the Department of Public Health, but we believe we'll be doing some initial notification of parents that they will be hearing from the Board of Health, and that their child or that teacher, whoever it is, a staff member, does need to remain home on quarantine and receive further guidance from the department, from the local Board of Health.
So just so I make sure I understand and our families understand, so suppose I am sitting in the front row on the left side of the classroom, and let's say it's a high school history class, and a student in the back row across the class on the left side, I think I was on the right, so they're on the left, so they're all the way across, and we're not within 6 feet of each other at all, and we don't have any contact during the class period, and that child is diagnosed with COVID, the student in the front left. Does the student in the rear right, do they have to quarantine?
They do not. The current guidance is that they do not. So
they would just monitor for symptoms like everyone else every day, and if they hadn't been within close contact for up to 10 to 15 minutes, then they wouldn't need to quarantine.
Yeah. Yes. So let's talk about that monitoring every day, Dr. Murata. That's a good segue into that. So as you know, we're putting final touches on a document with for parents with a lot of this information, and one of those is that assessment. Kind of self-assessment of your children every day prior to the start of school. And this is something that's being asked of both staff and students every day to answer kind of questions to themselves. Does my child exhibit any of these symptoms? And again, there's a list of symptoms that parents will be given. Or, have I traveled outside, or has my child traveled outside of Massachusetts in the past 14 days? And where has that been? And if it's, if it's outside of the if it's in the travel restricted areas, then that child could not come to school. Or have you had your child tested for COVID? Maybe you just voluntarily did that independently on your own. Once somebody is in that waiting period of waiting for their COVID results, they are required to quarantine or isolate until that result comes, even if they did it as an asymptomatic individual. Has anybody, has a board of health or a doctor told you that you need to isolate or quarantine? And if so, or anybody in your household? I'm trying to think, and do you know if you've been exposed? So there's a list of questions. So that will be in this parent packet or this parent guide. And we're all in this together as a community. And so we're asking parents to go through every morning and think about these questions before they send their children off to us. And if the answer to any of those questions is yes, do not send your child to school, and please call in and let us know why your child will be out. There are situations when children are out based on that information that we receive from parents that we'll be following up with those parents and advising them that child, basically just like if they had been in school, would meet the criteria for needing to be tested or needing to not return to school until they've tested negative for COVID. It's a
Great.
lot.
It's very detailed. I'm glad we have you. So I guess just another thing to highlight. So it's asked if my child is sent home and tested negative, when may they return to school? I think you did answer this, but I believe I'm going to have you just repeat the answer.
Yep. So I'll repeat it again, and some of this information will be in this guideline, and we'll continue to put out some information. So, again, if we have a child who's symptomatic, the parent picks them up, they go to be tested. Recognize that there are many different testing sites, and there's different timeframes for when we receive results. Some settings have results that can be ready in 15 minutes, but those are very limited, and others it's several days. Once you receive that negative result, your child stays home until we have that result. Once we receive that result, the rule is the child can return to school when they are symptom-free. There were symptoms that they had that caused them to be excluded to begin with. If they're symptom-free without the aid of medication, like Tylenol to keep a temperature down, for 24 hours, then they may return. So if that child went out on a Monday, but it took 3 or 4 days for that test result to come back, and they've been symptom-free for 2 or 3 days, then they could just, when the result is back, they could come back, that day or the next day. Does that?
Yep, that makes sense.
That makes sense. So that's sort of the way we see it.
Excellent. Thank you. How about masks?
Masks.
The mask policy now. Students will be wearing masks, but people are just worried about how we're going to keep children safe. Protocols around masks.
Sure. So I want parents to remember that we're in the education business, and one of our big roles, everybody, teachers, paraprofessionals, nurses, support staff, will be to sort of continually support and educate children around mask wearing. We recognize that this is not going to be easy for certain segments of our population, that they are going to have that tendency to fuss with that mask or to pull that mask off, those kinds of things. And so we'll be working on, based on the age and development, physical and developmental age of children, those teachers and support staff will be working on cues and different things to sort of help those children be more comfortable wearing masks. It is there will be times when a child takes off their mask when it's not a mask break. That is going to happen. And we will work to get that mask back on that child as soon as we can. Or we'll remove that child from the classroom maybe to do some individual work, those kinds of things. But again, when we're talking about those short spurts of time, that's not considered to be the big concern. The big concern is an extended period of time without the mask. And then remember, we will be doing mask breaks, and they will have masks off when they eat. So they will be at least 6 feet apart, if not more, during those times. Certainly, while we have decent weather, we're encouraging teachers to do as many of those activities outside as they can. But again, I think it's important to remember that the COVID particle travels basically on big water droplets, and the majority of mask is off mortar. The majority of those droplets drop within 3 feet, not 6 feet. And that's really why we wear the mask. That's trying to contain those droplets. But it's a very short period of time, and it's a short distance. So that being said, we'll be working with everybody on kids on mask compliance. We encourage parents to be working with their children and building up their tolerance of wearing masks, that mask be comfortable, it be fitting around their face without gaps, that it preferably be at least 2 layers of fabric. That's the suggestion from CDC, if you can possibly do that. That it's something that's easy for them to wash and wear, those kinds of things. We will have paper surgical masks in both pediatric and adult sizes. If a child forgets a mask, their mask becomes soiled, they don't have a mask, so there'll be plenty of those available.
Okay, Katie, and then also for our students that may rely on reading lips or other needing to see facial expressions, what kind of accommodations have we arranged for?
So the first thing we did was we went out and tried to find some different sorts of masks that have a clear plastic area so that one can see somebody's face or read lips. And so for our students who are deaf and hard of hearing, in some of our high needs special education settings, we're finding that facial cues are a really important aspect of communication with some of our nonverbal students, those kinds of things. Some of our English language learner students being able to see their English language learner teacher, see how they enunciate a word. So we have a variety of those kinds of masks available. And I think also there'll be some use of some shields. There'll be a variety of different ways that we, based on what the activity is, that we sort of accommodate those different activities.
Great, thank you. And I guess I'll ask, so suppose we do have multiple cases of COVID in the school, and we certainly hope to avoid that, and we'll work to avoid that, but it is a global pandemic, so that is a possibility. Can you talk a little bit about what the criteria would be for shutting down schools and the policies there?
Sure. So this is still, again, something that individual districts are working on, and the state is working on, and there are many facets about it. There'll be a variety of individuals involved in any decision to shut a school down, including our local board of health, obviously superintendent, our school physician, and Department of Education. So an individual case of COVID, we identify one student in a classroom, we do the appropriate exclusions for quarantine. Mary Connolly does contact tracing. We contain that. That does not shut a building down. When we start to see spread across different cohorts within our schools, or across grade levels, or across buildings, and we start to see an uptick in activity, we'll be starting to ask some of those questions and try to make those decisions about whether we're able to contain that spread safely and remain open. We are also being asked to, again, in working with the local boards of health and at the state level, there is a new matrix that's been developed that's a green, yellow, red, that talks about transmission rates across the community. And that's a really important aspect of all of this that we do. And this is why it'll be a group effort here when we make these decisions. If the community transmission rates significantly increase, even if we're not seeing tremendous a number of cases in our schools, there may be a time when it is suggested that we change our model or we go remote. So I think the most important thing for families to know is that we will be having daily conversations with the Board of Health. We will be tracking all of our cases together. Right now in Haverhill, I think Mary Connolly's very publicly talked about the fact that right now most of our transmissions have been within families or within our skilled facilities, not so much family to family. So there have been known contacts. So we'll be using that same sort of model within our schools. If we have a child in one school from a family who tests positive, then we'll be working with that family in all of his other schools to have where the siblings are, being very aggressive about trying to contain that. So I wish I had one sort of single answer that if it's 5 cases or 10 cases or 2 cases, that would be the shutdown. I don't, it's not that simple. But for everybody to know that this will be, this is data that we'll be tracking every single day and working to make the best decisions for the staff and the students in Haverhill.
Thank you. And I guess so one final thing that I certainly hear a lot, it was recently announced that, we need to have, students will need to have a flu vaccine this year by, I think it's December 31st. I think that was a surprise to many people, that it would be mandated. And I know, we are still working on procedures internally, and there'll be more information coming, but is there anything about that you'd like to share with families, just to highlight that it is in fact a new requirement?
Sure, of course. So yes, this was new to us, and we're digesting it as school nurses and as a community about how best to support and monitor this. Again, I think that the concept here is that the flu vaccine is pretty effective in reducing transmission of flu through communities. Many of the symptoms of flu are very similar to the symptoms of COVID. So we're trying to eliminate as many possibilities as we can. The flu vaccine isn't perfect. No vaccine is perfect, but for most healthy individuals, there's a pretty high success rate with it helping to mitigate or reduce the transmission or the number of flu cases. So yes, the nurses will be reaching out, but more information will be coming to parents. We wanted to kind of let people get in the door first, but kind of talking about this regulation. What it says, Margaret, is that all students who are enrolled in the school system will be required to meet the guideline of having flu vaccine prior to the end of December, and that includes our fully remote. And I know that's a question that's come up a few times. So again, we are arms of public health here. We just follow the guidelines we're given, and we do our best to work with families on those. I actually have a conversation today with a local organization who's asked about trying to help us support families in getting flu vaccine. So just like we'll be offering information about ways to get testing for COVID, we're going to be offering different suggestions for families to get their child's flu shot. My first recommendation in all these scenarios would always be to contact your primary care physician and find out what their plan is for it. Once you get your child's flu vaccine, please get a hard copy to that school nurse, and that will be entered into our immunization database for that student. But the nurses will have a big job this fall following up with parents and trying to support them in this regard.
Oh, thank you, Katie. This has been so helpful. You've answered so many questions. Is there anything that we haven't covered or that you think is really important to get out there to families that I haven't asked?
I think just to say that we have a tremendous dedicated group of school nurses here in Haverhill who are masters at infection control and managing public health type situations. That's what school nurses do. This is our day-to-day work. It's a change for us. Our flow in our health office is going to be different. We know there's a lot of anxiety, but they will do their best to answer your questions. I am available to answer individuals' questions. I've spoken to many families over the last month or so, and I encourage families to reach out to me. Sometimes I just think it's easier to have that conversation. I think we can understand each other better. So they should not hesitate to let me know if I can answer a question.
Well, thank you so much, Katie. Greatly appreciated. I know you were busy before COVID, and you're just beyond busy now. So I appreciate you taking the time to sort of put some people's mind at ease and to answer some questions.
Thank you, Dr. Murata.
Well, that was really helpful. I think Katie has such a calming influence, and she's so knowledgeable. I know it puts my mind at ease. I know she's got a great team, and they're really ready to get back to school and to assure that all our students in our buildings are safe. I think she answered a lot of questions that we're hearing in the community, and I know that there are always individual questions and individual circumstances, and somebody always wants to go deeper, and that's fine. We want people to feel comfortable with the return to school. As Katie mentioned, you can feel free to contact her directly. If you have more general questions, you can also email our Reopen 2020 at Haverhill Public Schools email. And we would love to hear from you there. We're happy to answer individual questions there, or if you have more broad questions that you'd like us to answer in a future weekly update, we'd be happy to do that as well. So I appreciate everyone's time, and I hope this has been helpful to you. I know it's been helpful to me, and hang in. We'll be back in school soon, and it'll be a welcome relief in many ways for all of us.